Okay, so let me introduce you. Thank you everyone for joining us for our fourth in a series from Starwood. Equine, we really appreciate their support of CDS East Bay and all the great information that they have provided for us in the past. And we're excited to have them come and chat tonight about biologics. Biologics is it's not necessarily new, but it's actually evolving very quickly. And apparently there are a lot of great things to talk about and to consider for both ongoing support for your horse as well as maybe intervention types of support, I guess. So um, our vet tonight is Dr. Michelle, and we also have Dr. Kelly and Dr. Bridget on. We would appreciate it if everybody does wait until the end to ask questions. And if you want, you can just type them in and then we'll get to the end and Dr. Michelle can grab a hold of those and give you the answers. So Michelle, have at it. Thank you so much for joining us.
Yeah, thanks again for having me. Excited to have this chat with you all. So today we're going to be talking about the use of biologics for equine musculoskeletal diseases and kind of the array of things that they can do to support our friends. So first, we'll kind of start off with an overview. So we'll start small. What is musculoskeletal disease? And then kind of why do we care about regenerative medicine, biologics? What are biologics? And then we'll dig into the products themselves, autologous blood products, stem cells, bone marrow aspirate, other sort of regenerative adjunctive therapies, and then some practical examples on how we can use these things in kind of case-based situations. So first we'll start with an overview of musculoskeletal disease. So this is kind of a photo in the corner of a normal healthy joint. So there's a few different components. There's synovial membrane, which is nice and flexible, the joint space, which contains thick and elastic synovial fluid, and healthy cartilage covering those bones. And so as you guys know, degenerative joint disease or arthritis or osteoarthritis is one of the main causes of retirement. So we do want to kind of, prolong the longevity career-wise and overall for joint support of our horses. So musculoskeletal disease obviously plays a large role in this. So in health, these bones glide against each other with little to no friction. They're buffered by that articular cartilage you can see in that picture and a slippery synovial fluid providing nice cushion and lubrication. And that synovial membrane produces hyaluronic acid, gives it viscosity, delivers nutrients to the cartilage, removes waste. And so when the cartilage is damaged, as in arthritis, the body responds, as you guys may know, by increasing production of that synovial fluid. So that's when you see, effusive joints in order to compensate for that diseased joint. And that can cause further distension, further pain. And it's complicated by the fact that that articular cartilage, which is so, so important, contains, little to no blood vessels, lymphatics, or nerves. So it gives it a pretty limited capacity to heal and repair. So that's why it's especially important where we come in and try to help repair it early on. And so when this process goes awry, this is kind of a little stepwise diagram. So first you can see, you have your nice healthy joint where we started, and then it progresses, you get some joint space narrowing, thinning of the cartilage, the synovial membrane starts to get fibrosed and rigid and inflamed. And so the defining feature of arthritis is the breakdown of this articular cartilage, and it'll become, the composition will change, it'll become weaker, more damaged, thin, worn. And unfortunately, the body tries to heal and lay down new cells, but unfortunately, these are biomechanically inferior compared to the original cartilage that was there before. And so this will lead to underlying, more friction from the bone, impact, and eventually, when you get your radiographs and there's little bone spurs or osteophytes, that's compensation for that missing cartilage, which can limit that joint range of motion, and make further, stress on that joint, other joints, other soft tissue structures. And so this process is caused by pro-inflammatory cytokines. And cytokines are a signaling protein in the body, and they break down cartilage and cause tissue damage. And so again, this is another diagram, stages of joint disease. You have your nice healthy joint. You have the second picture, a little bit of synovitis. And then the point of no return is when the articular cartilage is disrupted. And so at that point, you get that thinning, and then eventually you'll get bone on bone in, severe arthritis cases. So our goal is to try to intervene in this and slow this process down. So why is regenerative medicine, biologics, why is that such a big field that we're interested in right now? And how is it different, than the typical sort of steroid-based medicine? So if you have damaged tissue, it fills in with scar tissue. And unfortunately, scar tissue is, again, not as good as that original tissue. It predisposes to re-injury, it's poor quality. Ultimately, it's the osteoarthritis progresses. And the hope with biologics is that can we encourage regeneration of this original type of tissue? So whether it's a tendon, ligament, bone, cartilage, and can we have faster healing? Can we have more elastic tissue, stronger tissue? And the goal obviously is to increase longevity of our partners' careers, their overall comfort, and try to keep, their body as long as possible. This is kind of a broad overview of some of the exciting things that we can do, and certainly we'll dive into this in a little bit. But we can, as you know, in the top left picture, collect blood. So biologics is using the horse's own products to instill in them, whether it be in one of these places listed, to improve for whatever sort of reason, depending on the biologic you're using. So the left picture kind of illustrates when we are doing, PRP, ProStride, we're taking the horse's own blood, and depending what biologic you choose, going to put it through a couple different steps. The middle picture and the right picture are demonstrating stem cell collection. So if you were to get stem cells from your horse, it could be collected through either fat tissue, which is adipose tissue in the middle, or through bone marrow aspiration, typically done at the sternum. And so those are just illustrating two ways that we can also get the horse's own products, biologics, isolated from the horse. And so going further into this, so the horse has naturally occurring anti-inflammatory protein. So it's constantly a battle of pro-inflammatory, anti-inflammatory, whether it be in a joint, in a tendon, in a ligament, in the overall horse's body. And the goal of biologics is to take the horse's own anti-inflammatory markers and concentrate that, reduce the pain, protect the cartilage, reduce the degenerative joint disease that is going to occur. And so some therapies also aim to stimulate endogenous or self-repair mechanisms. So in addition to providing anti-inflammatory relief, trying to get the body itself to be like, I should repair and repair correctly. Overall, biologics, the goal is not only short-term reduction in inflammation, but to go beyond that, to address the underlying joint environment and change that for the better long-term. So next we'll dive into specific biologics. So we'll start with autologous blood products. Autologous, again, meaning self from the horse. And why choose these products? So typically we still do it, but another way was to do corticosteroids, which are excellent at reducing inflammation and are really, really effective when there's such a strong inflammatory component, unless when we're trying to, address tissue degradation. So this is where biologics or autologous blood products really come in. So this is in young performance horses who need a little bit of extra support. So decrease that inflammation within the joint. Older horses who would have contraindications for steroid uses. So those who are potentially cushingoid, metabolic syndrome, that sort of thing. And then horses who need extra support in the healing process. So that could be something like a tendon injury, a ligament injury for intra-op or peri-op procedures and that sort of situations. A couple autologous blood products that we'll talk about. There's many, on the market, and they kind of come, in and out of fashion as we get research, better products, that sort of thing. So we'll start with the first big one, which is ProStride. Prostride is, Starwood's method of choice for a variety of reasons. It kind of sums up all of those different autologous products into one really, really excellent concentrated solution that we can deliver to the horse's joints. So this is autologous. So how we do that is we draw blood from the horse, stall side, we'll put it through 2 different spin cycles, and then deliver that into a intra-articular, so in the joint. And Prostride has a good anti-inflammatory, good regenerative effect. So it does both of those things, reduces inflammation and promotes a regenerative environment for the better. And so overall, pain and damage in the horse's joint, as we kind of discussed, is caused by pro-inflammatory cytokines or signaling proteins that cause damage to the cartilage and break it down. Prostride goes to block these things that contains IRAP, which is interleukin-1 antagonist protein. It also includes other things such as tumor necrosis factor alpha and other sort of cytokines needed to block development or slow the progression of osteoarthritis. And so Prostride is really good at taking the horse's naturally occurring anti-inflammatory proteins and getting a really good concentrated solution out of that. And some research has shown too that Prostride blocks key pain molecules better than some kinds of steroids and IRAP in a couple different studies. And so right here in our bottom 2 bullet points, alpha-2M, so some of you may have heard of alpha-2EQ as another standalone biologic. So Prostride actually contains the active sort of ingredient in alpha-2EQ. And so it contains it in equivalent or higher values. So again, Prostride kind of getting all of these things into a really good regenerative soup, essentially. It also contains IRAP. So again, takes another standalone product and contains that as well. So an excellent product. And let's see if I can play this little video. So that's a little stall side centrifuge going for you. So we can do it right by your horse. The blood, spin it down and inject all in one go. There we go. Got stuck for a second. Next up, we have platelet-rich plasma. So again, this is from the horse. We take blood from the horse, put it through a spin cycle, and you get your platelet-rich plasma solution. This has a fair anti-inflammatory effect, but a great regenerative effect. And so how this works is platelet-rich plasma is rich in clotting components called platelets. And when platelets are exposed to damaged tissues, they degranulate, or they kind of open up and break and release chemicals called growth factors. And these growth factors aim to accelerate and assist in tissue regeneration and repair directly to the site of injury. So this is an excellent solution for healing of soft and hard tissues. If you have core lesions, we can inject right into, a tendon and get right to the area of injury and get that repair going, and great regenerative effects. Next up, we have alpha-2EQ. So this would be kind of the standalone product. Again, it's contained within the Prostride as well. And so this alpha-2EQ product has the main product in it, our active ingredient, is alpha-2M. And so as you can see in the little diagram, it has all these little Pac-Mans. And those are proteases who are trying to cleave certain products to essentially get and break down the cartilage. And so alpha-2M, that little molecule right there, tries to bind them all up. So those enzymes can't go and degrade the cartilage and make a pro-inflammatory environment and release that through the bloodstream. And so in doing so, it has obviously an excellent anti-inflammatory effect, but a minimal regenerative effect. Really good at getting the inflammation down, but less so in kind of promoting self-repair and using the self mechanisms to regenerate the area. Last for autologous blood products is IRAP. Again, this is also contained within the Prostride solution. So it's a concentrated interleukin-1 receptor antagonist protein. And so it combats the inflammatory protein interleukin-1. And this product typically was used, typically was used for synovitis or mild to moderate osteoarthritis. Historically, it had to be incubated for a period and then put through a centrifugation step, and the joint treated every 7 to 10 days for 3 or more treatments. So With the invention of the other products, this product as a standalone product has obviously fallen out of fashion a little bit, but still it's done and still has excellent results as well. Next up, we'll talk. So this is kind of a particularly exciting and new thing that we're starting to do in practice. Cells are, as you guys probably know, they can differentiate into many different things. So a stem cell, in theory, could become cardiac tissue, tendon tissue, ligament tissue, a variety of different tissues that it decides to become depending on the environment it's in. So injection of these stem cells will integrate into tissue deck to replace and repair. And the goal is in stem cells, it will become a more normal repair. So that injury will become more like the original tissue that was there, as opposed to that scar tissue, the fibrosis that happens when we try to lay down secondary tissue. And so in addition to doing that, they also secrete many anti-inflammatory things that go to improve overall gene expression in that damaged tissue. I like to think about these as directing the orchestra. It used to be thought that the stem cells that you would inject into the horse would actually differentiate themselves. But in fact, what research has found is that when you inject these stem cells, it recruits resident stem cells to the area. So a little bit different mechanism of action than was originally thought, but injecting these stem cells will direct the orchestra, get your resident stem cells there. There's two different types of autologous versus allogenic stem cells, and so they come with different pros and cons. The autologous stem cells to be sedated. So kind of like we talked about the fat tissue or the bone marrow. So a horse will have to undergo, sort of sedation, standing sedation. And then those stem cells are sent off for processing and then injected. Those are autologous meaning from. There's allogenic, or ready to order stem cells from a donor horse. That was if you brought your horse to an institution, didn't have go through the harvesting process, and you just injected stem cells right there. And so the original thought was maybe this would be viewed as non-self to the horse, but research ongoing has shown that this is not the case, and allogenic cells have been used with great success, especially of recent. So allogenic stem cells become much more popular recently. And an example application of these mesenchymal stem cells would be for arterial injection. So it could be the case that you have a diffuse injury to your superficial tendon. And so it's the thing where PRP wouldn't be able to get necessarily a single core lesion. So you could do intra-arterial injection, and that would get the whole distal limb area bathed essentially with the stem cells, and hope that they go repair, replace with more normal tissue, promote anti-inflammatory in the area of injury, and all that good stuff, and try to get it to a more normal environment. Next up, for our biologic options, we'll talk about bone marrow aspirate concentration. And so this has fallen a bit out of favor because it's a little, invasive. We have these other options. What it used to be was that you could harvest from bone marrow, you could harvest cells, and that would be your stem cells, these chemokines, cytokines, all of the things we've kind of already discussed, and stall side, put it through a centrifugation step. It wouldn't have to be shipped out, processed in the clinic, done kind of all in one spot. But given the other options we have, pros and cons isn't really done quite as much, but has been done nonetheless with good success. So next up, we'll talk about some regenerative adjunctive therapies. I was excited to talk about biologics, and in doing that, there's other parts of regenerative medicine as well that will stimulate the body's own self-repair mechanism. So I've included a couple of those. The first is shockwave. So You may have seen this little shockwave set up before. This is similar to the one that we at Starwood have. So a physical shock wave actually stimulates the cells, and the mechanism of action of this has been widely debated. A couple of the reasons that we, know that it causes therapeutic outcomes to be positive, and it increases vascularization. And so what that is the increase in blood vessels in that area and blood vessels to that area. So that'll help you get, more oxygen, more nutrients, remove waste, all that good stuff. And then upregulate anti-inflammatory cytokines and gene expression appropriate of the environment that we're shockwaving. And so healing effects we see for 2 to 4 weeks after a shockwave. And in addition to this, you do get a period of pain relief. And so that pain relief is about 4 days in the horse. In humans, it's documented more like a week. So of course we can't ask our horse friends. So it's a little up for debate, but around 4 days is the period of pain relief. And it is something that you could potentially do, but you have to see USEF and FEI withdrawal times because some of these horses have to be sedated as well. Another sort of self-repair regenerative technique we can use is laser. So laser is classified by power. So there's class 1, 2, 3A, 3B, 4. There's multiple kinds of classes of laser. And so my first I wanted to do was kind of use the pool analogy to break down what the different classes of laser mean. Because we have at Starwood a class 4, and there's many other kinds of lasers that you could use and with potential success in things. But to break it down further, overall, the dose, wavelength, and power contribute to laser effectiveness. And so wavelength is limited by the class. So that is kind of what defines class 1, 2, 3A, 3B, 4, etc. And so a power can deliver effective dose deep into tissues faster, but you're limited in your depth of penetration by your wavelength. And low wavelength, with that being said, might be adequate to penetrate more superficial wounds, but not deeper wounds. And so going to the pool analogy, let's say class 2, the wavelength is lower. So on the steps on the pool, or you're standing on the steps of the pool, it might heat immediately to the source. So we might feel the pool get warm while we're standing on the steps. As soon as you get off the steps, you're not going to feel the warmth anymore. So that would be like a class 2. The rest of the pool is never going to get warm, just the area by you. There's not enough, energy to penetrate the area, and the wavelength, not enough to get to the rest of the pool. Class 3B, that will heat the pool fully. There is enough, to penetrate heating the pool, but not as quickly as a class 4. A class 4, you'll stand on the steps and you'll be like, I want the pool to heat. And then a minute later, the whole pool will be 80 degrees and it will be perfect and it will be ready for everyone to get into. So the main difference in 3B and 4 is the amount of time needed to treat an area. So with that being said, an example of that, so a class 4 laser, if we're going to, which is what we have, if we're going to do the back, that typically takes 30 minutes to laser the whole back with a class 4 laser. On the flip side, if you have a class 3 laser, do the job, but you might be standing there for 4 or 5 hours lasering the back to get the same effect that you would in a class 4 laser. So that's kind of how the lasers work. And I hope the pool analogy is helpful. I think it's an easy way to describe the different classes and how they can be helpful depending on how deep and how long you want to be there. And that's kind of how that works. And so how laser helps the body is it kickstarts the body's biologic process. So those wavelengths are absorbed into the mitochondria, which is the powerhouse of the cell. You get a boost in energy production to help the body work more efficiently, better circulation, improved transport of oxygen and nutrients, lessening of inflammation, you feel cellular production, all this good stuff to accelerate healing. And this is typically done 2 to 3 times a week, but is largely case dependent. And it's, commonly used to accelerate healing of many lameness disorders, soft tissue injury, and that sort of thing. So bottom right there is one of the ones we have, a class 4 laser. And so 2 other things I kind of wanted to touch on were Adcon, Pentosan, or Zycosan. and legend, kind of the difference between the two and how those can also help repair, the body's mechanisms, and overall help joint support without, the use of other sort of disease sort of changing drugs. And so Adequan and Pentosan are similar in their mechanism of action. So this is a disease modifying injection. So Adequan, as many of you I'm sure are familiar, is one intramuscular shot every 4 days for 7 injections. So so many people will probably have a question, should we do the full series every 6 months? Should we give an Adequan injection weekly? Should we give an Adequan injection monthly? We want to do whatever's best sort of thing. And so in order to get the full effects of Adequan, which the goal of Adequan is to decrease inflammation of that synovial membrane, to increase hyaluronic acid levels in the fluid. It gives you the building blocks for the body to make its own hyaluronic acid, and overall restore joint lubrication, repair cartilage, all the good things. If you do every 6 months, it has those effects. It improves the joint environment. If you do once weekly, once monthly, it's a great injection as well. It's more of an anti-inflammatory injection as opposed to distributing in all of the joints, for enough building blocks to improve the joint environment and lubrication. So both are really good, just used a little bit differently. And that one is more widespread to, improve the environment overall. And the other one is a really nice anti-inflammatory injection. And so one of the main differences between Adequan and Pentosan is that Adequan is sourced from an animal product and Pentosan is sourced from a tree. So depending if, you're someone who prefers a non-animal product, Pentosan is like kind of be your go-to over Adequan if you were picking that way. Pentosan is 1 intramuscular shot every 7 days for a total of 4 injections. So it's injections. It's a little, less intensive than the Adequan series. So 2 different options, and overall inhibits the loss of key joint components, inhibits breakdown enzymes, and promotes rebuilding by the body. Compared with legend. So legend, is disease masking as opposed to disease modifying. So given either intravenously or intra-articular. So sometimes you might have it paired, given in the joint or given in the vein. And so the goal of legend is to decrease inflammatory mediators in the joint as well, and improve synovial fluid quality by supplying the hyaluronic acid. So instead of giving the building blocks for the body to make its own, it supplies hyaluronic acid, or one of the important components of joint fluid itself. So the pro of this is that a one-off injection can make a difference. It can make a horse feel really good. A horse is, going to go to a show. They want to have a nice legend shot, make their joint all really lubed up and great. Absolute pro of legend. A con is that it does go out of the system and doesn't quite have as many of the repair regenerative effects as Adequan in terms of disease modifying, but both are similar but different in that, Adequan will modify the process of degenerative joint disease, and legend will help support through that process. So a couple little case examples to put some things we talked about for biologics, to real world scenarios. So the first one is a warm blood mare who has decreased hind end propulsion. So she presents and she is positive to upper limb flexion of her hinds, and she is pretty dang sensitive to palpation of her SI. So things that we could potentially do for her, knowing biologic regenerative treatments that we've discussed, we could do Hock injections with Prostride, so help alter that joint environment. A good anti-inflammatory effect, a good regenerative effect. She's a young mare. And then we can shockwave the FA. So that would also provide some pain relief, break the pain cycle, as well as helping out that environment in the long term. And so here is a little fun video of us doing some Prostride, one of the centration steps. The next example is a gelding with a superficial digital flexor tendon injury. So the horse presents and we have an acute onset lameness with bowing of the superficial. Pop the ultrasound probe on and we see this. And so right here, we see our superficial digital flexor tendon. And you can see that in the middle of that, there's a dark spot. And so that is a core lesion in that superficial digital flexor tendon. And when we flip our probe sideways, we see it again in long axis. And so you can see that defect running through those fibers right there, because those fibers should be nice and horizontal, and they're missing. So what potential strategies we could use, to accelerate healing, to lay down more normal tissue, right? Because if this tissue heals, it's going to try to repair itself with a secondary fiber, secondary collagen that are inferior to the original that we were. So what can we do? We can put some platelet-rich plasma directly into that core lesion. Again, great regenerative effect by the platelet-rich plasma. Help get those fibers in both quickly and in an organized fashion. We can start lasering 2 to 3 times weekly, accelerate healing, get the cells, going, get them energized. And then, of course, rest, all the other things that come with soft tissue injuries. But using those applications for biologics and regenerative medicine that we learned in this case. And that is my talk. Thank you guys so much for hosting me. Big thank you to all of you. And I'm happy to take any questions, and I've posted my email as well if anyone has anything further they'd like to talk about.
I think we've got a couple of questions, actually. That was really informative. Thank you. So the first one is, what are the cost differences between these different modalities?
Yeah, absolutely. Yeah. Oops, sorry, we're getting all situated. So cost differences between these different modalities. So ProStride will depend how many kits you're going to use. So it's kind of a difficult question, unfortunately, without having a specific joint or specific area in mind. Larger joints tend to take more kits, whereas otherwise you can get away with, one kit in different areas are split between joints. So unfortunately, it's kind of hard. I'm sorry, Luca.
You could compare it to, say, like if you were doing hawk injections with steroids versus the ProStride biologic.
Okay.
Yeah. We could do, so let's say we were going to do hawk injections with steroids, and Dr. Zaytunian, correct me if I'm wrong offhand, please. So, you have to include your farm call, your sedation, those sort of things, but it'd be around, gosh, all in all said and done, $700 to $800 for steroids. And then the ProStride kit, because there is, a lot of processing that goes into it, a lot of extra steps, supplies, and specialty things, that will be around more $1,000 to $1,100. How does that sound to you, Dr. Zaytunian?
I would say, yeah, probably even a little bit more. It ends up being for a set of hawks, a set of joints, it's an additional $700, give or take, for the processing and for the kits.
Yeah, so about 1,400.
Yeah.
And our second question is there evidence and research for length of outcomes for the blood products? For example, how long is the benefit of the benefit of initial treatment lasts for pain relief, decreased inflammation, etc.? And then additionally, what is the indication for frequency of administration?
Yeah, so Audra, good question. This is another one that is going to be largely dependent on the horse and its needs. So some horses who they can be on different maintenance schedules if they're one that needs maintenance injections and not just, a one-off, get them through the certain kind of inflammation period they're experiencing. So it depends largely on, if they're on an annual schedule. Basically, wherever they are in that spectrum of arthritis, and again, it's a spectrum, and so depending how much inflammation is ongoing will ultimately decide how long it lasts for them. So how much pain relief it's going to give them, and then that'll help determine the frequency of administration.
To follow up on the administration question, I think like maybe a better way to phrase it for me would be like, is there a point in time where like, what is too much? Like, is there any research about like, what is too much? Because we know that with steroids, and I'm just curious, like, is there an upper limit for blood product, or is it just kind of like you're looking at a more organic situation where like, we're twice a year is like, clearly the horse can't handle this anymore. So we need to think about retiring them, but like, are there people like, is there any harm, for example, for frequently administering, and like, what is the upper limit of that administration? I'm just curious.
There's no upper limit in terms of, repeated use will be detrimental to the cartilage environment. There's no known upper limit in terms of that. So I think you hit the nail on the head with the second part of saying, it's more organic, seeing how it responds and that sort of thing. I think you're right on it there.
Okay.
And I can add in another little bit of information or nugget is some of the original studies that they did, at least with the ProStride system, they followed the horses out for a year and did find that it was efficacious in some of the patients for a full year. I think we found in our practice that, if we're getting a year, we're feeling really great. But we do have some horses who, as Dr. Laiolo shared, as like, who do we pick to use this product? Who do we pick to use these biologics? One other demographic of patient is that horse that's received, we know where the lameness is coming from. We've done steroid injections. Those steroid injections have not lasted, at a minimum. We don't want to go into the joint with steroid any more frequent than 6 months. And so those is we then go to using the biologics, and we have a couple patients with, pretty progressive arthritis who are having the injections done about every 4 months. And we feel okay about that because we're not going in and, creating any degradative processes. We're actually helping repair. So I think that's as frequent as we go in with the ProStride. The IWrap is labeled when you do the initial series, you actually give a series of 3 injections at 2-week intervals. That's another reason we kind of like the ProStride said is every time you go into a joint, you're at risk, right? We're in a barn setting. It's dusty, it's dirty, it's we do the best we can to be as sterile as possible, but when we're sticking a needle into a closed space, there's a risk. So there is no upper limit. You can use it more frequently, but I would say in our hands, 4 months is kind of the frequency where we're utilizing it, but not if more than that, we're kind of asking ourselves like, should this horse still be doing this job that we're asking of them?
Thank you.
Oh, absolutely.
Next question from Andrea is, where does Arthrimid fit in?
I actually included this just in case it was asked.
Okay.
So here is, some information on Arthrimid. So Arthrimid is a hydrogel. And so how it works, it's kind of like a midweight 2.5% hydrogel. And what it does, compared to other hydrogels, it is a midweight one. So it tries to integrate actually with the synovium, which is again, that lining on the outside. And so that's the main therapeutic action of Arthrimid, is by integrating into that. And so synovitis is one of the most important factors, among some other ones that contribute to the actual pain process of arthritis. And so this kind of acts as like a bioscaffold and integrates into the synovium itself to reduce that pain and to kind of improve that joint tissue overall. And that's the way Arthrimid works. It doesn't necessarily have as many of the regenerative aspect of ProStride, your PRP, that are going to stimulate the body's own self-repair mechanisms, self-repair signaling proteins, but it does integrate into the synovium to provide pain relief.
So it's an injected product as well?
It is,
Okay.
yes. It comes in a syringe that you can inject.
Okay. Next question is, does insurance cover ProStride?
Yep, insurance will cover ProStride. Of course, if there's an indication for it, the insurance will cover it. Yep.
Mhm.
It will not cover it for simply like joint maintenance. So if you have like a specific injury or case that you've opened up, many insurance companies will decline coverage for a diagnosis of arthritis. There's ways that we can be creative with how we fill out the insurance form to support as often and as best as we can, but it's like, yes, it does cover it, but we have to be careful with how we complete the documentation.
Okay, and then Karen asks, would you do a full workup first or just go with the owners that want that say I want this? And how do you determine the treatment plan?
Yeah, so we would do a workup. Ideally, when you're giving this, one of the things you're giving it for is to be disease modifying and reduce pain. So being able to track that by doing a baseline musculoskeletal workup, seeing if there's effusion, seeing if there's sensitivity to certain flexions, lunging different directions on different surfaces. That is an important milestone to decide, okay, is this an appropriate step that we're taking in order to reduce inflammation and pain evidenced by our musculoskeletal exam? And then being able to potentially do a recheck afterwards in order to be like, okay, this worked, this was the correct solution, or do we need any of the other adjunctive modalities on top of that we kind of discussed? So a workup is a really important step just to monitor progress in addition to being able to see repair long term and if we're making a difference in that horse.
Mhm. And then this goes back to the maintenance question. Do people use ProStride? That's my question about ahead of the issues, say in a 10-year-old horse. So you're using Adequan already. Would you switch to doing ProStride? Would that be of a benefit if there's really no true lameness existing?
Dr. Zitunian kind of touched on this like a little bit earlier, what you're saying. Injecting a sound horse gives me a little bit of pause just because there's always pros and cons with every injection that we do. Joints are obviously a very sterile environment and do all the things and all the precautions that we can take. But inevitably there is risk that comes with putting a needle in a joint. So that's an important thing when considering, do you want to inject a sound horse? With the horse's sound, there's not a problem necessarily that we can see. It might be a little different of the case if you have, a sound but radiographic changes that could potentially, change your game plan a little bit, change whether you want to inject that or not. But in terms of getting ahead on a young horse, doing an Adequan series, a Zycosan, Legend, all of those would be the forefront of what I would recommend doing, and just do that, get ahead of it that way, lubricate the joints through those sort of easier things, less invasive things. And then if need comes on the line, then talk about intraarticular injections.
And I would complement what Dr. Laiolo said by the addition of, we do have cases of sound horses that we've created sort of a historical regimen that we know that they need. There's a couple patients I can think of that almost like clockwork at the 6-month mark, we're getting a call saying they're sore. And when we start to see that trend, we then have a conversation of, you know what, let's not wait until they're sore because we've seen this repeated action. And then we put a reminder in the system that they get the email and say at the 5-month mark, hey, we're coming up. How's everything going? Would you like to schedule? And you feel better about doing that with those biologics, right? And having the frequency be a little bit more. So that would be the only time I would say where, even if that horse is sound, I know because they've proven it to me time and time again, that would be a time where I would inject and try to get ahead of and not have, compensatory issues because we've let them become sore.
Right. And then this next question is, she's saying, would supplements help a sound horse? And I would add to that question, because I know for humans now, they're offering all these NAD plus supplements, for the mitochondria, and hyaluronic acid supplements that are liquids and that kind of thing. Do those actually help? Do those play into a regenerative or self-regaining environment for the horse? Or have you I mean, or does the stomach acid just kill it all anyway? I'm curious about that.
Yeah, the tricky part with supplements is that you just alluded to it. When they get ingested, they do have to endure the pH of the stomach, which is obviously very acidic. And then after they eat things, and this goes to other pharmaceuticals too, they have to undergo different ways of metabolism. The liver sees it, the kidney sees it, and it's broken down in all sorts of ways. So the ingredient that they get and ingest is not necessarily the ingredient that gets broken down. So also, with that being said too, the horse is very large. It needs, very large concentrations of certain drugs, in addition to not being super bioavailable to the horse. So that's one of the tricky things with supplements. With that being said, though, of course, there's some good research on glucosamine, chondroitin, MSM, some of those. And so there's certainly no harm in giving those. And those are kind of some of the big blocks to try to see if we can give it to them, get those, the positive joint environments, all those things, good articular cartilage, good fluid. So certainly there's no harm in supplements for a sound horse. Let's do it. Let's try to get ahead of it as much as possible if it works. And some of them do have really good research. Platinum CJ line, for instance, has very good research behind it. So getting started on something like that is absolutely always a good idea.
Okay. And then Karen has another. Karen, do you want to talk to your question here?
Sure, thank you. I was typing, so I didn't hear your full answer, but when you got to the platinum CJ, that seemed to be an answer to the question.
Oh, no. Oh, to your question, I see.
Oh, sorry. So my question was, is that what you're saying, Vicky? You want me to say my question out loud?
Yeah.
Okay. So my question is about my horse, who is a 17-year-old warm blood, going strong, still blossoming. I want to finish her to Grand Prix. She has an excellent diet. I do a lot of PT, Beamer, laser. I do everything. So my question is, what are your thoughts about like Equine or any of the therapeutics that we've talked about, just to support her, even though there's not a specific there's not a lameness or known condition?
Yeah, absolutely. I think she would love some Equine in her life. I think it would be a great thing for her. It's always, it's better to get ahead, right? Equine, Pentasans, like I said, they're disease modifying. If we can get ahead, we can prolong the time it takes to make that disease progress. So even if she's not displaying signs now, clinical signs, being able to do that for her now will hopefully push out that process. And then with kind of circling back to the pharmaceutical thing as well, nutraceuticals, supplements. So the nutraceutical field isn't regulated. So it's really important that we choose brands that have really strong research behind them. And so that's kind of when, Platinum is a really good go-to, because they put research and trials at the forefront of kind of what they do. So picking a product, if you're going to pick a product that has a lot of research and evidence-based, things behind it, is important to put your money towards that versus, another product that might not have as much research or backing behind it.
Yeah, so she is on Platinum Equine, so it sounds like the CJ is worth the investment.
Yes, yeah. I would say CJ, and then definitely the Equine series as well would be great addition to her plan. Sounds like you guys have big plans together, so I all best.
Thanks.
And I'll often tell people, if you have a set amount of funds, this is what I have to spend on joint support. It it's fairly from a cost perspective to buy and utilize the Platinum CJ on a daily basis as it is to do a series of Adequan twice a year, which is our typical recommendation for our sport horse, demographic, which is what it sounds like your mare is in. And so cost wise, if one of those is an option, I always lean towards Adequan because we know systemically it makes it from a muscle injection into the drug within 24 hours. We see an increased level of hyaluronic acid. And that Platinum CJ does also have great research, but I think bang for your buck, the Adequan's going to come out a little bit stronger. So as long as you are comfortable with giving the muscle shot or have a veterinary team that can perform those for you. When I say Adequan, I should say also Zycosan. The two of them are equal in their efficacy. Spend your money on the systemic Adequan or Zycosan first, and then next level would be the Platinum CJ.
And it obviously doesn't hurt to do both, to support both ways.
Absolutely.
Nutritionally and, with the injections.
Just the pocketbook. So, when helping people to budget, I prioritize the injections first.
I appreciate that. Okay, does anybody else have any questions? All right, well, this was really great information. Thank you so much. We really appreciate all the gals do for supporting CDS and our programs. And hopefully we can come up with another topic here soon and get you guys back on.
Thank you so much again for hosting this. And thanks for everyone for their excellent questions as well.
Absolutely. Thank you.
Have a good night all.
Everybody, good night.
Good night.